Well, we're joined now by Dr. Odianosen Ehiakhamen, who is the National Mpox Technical Working Group lead at the Nigeria Center for Disease Control. Good to see you, Dr. Odianosen. Let's start from the periphery and talking about what you think about the current status of Mpox outbreaks around neighboring countries around Nigeria.
Okay, so probably just provide a context on
Yes.
Mpox and how it used to be called monkeypox, and in 2022 name was changed. Nigeria is pretty not new to Mpox. In 2017 there was a re-emergence. Before that, our first case was 1971, which was about 1 year after the first case in DRC. It was called Zaire at that time in 1970. And after that we had a set of cases in 1978, and it seemed to have disappeared, until 2017 when, it was picked up by one of our key ID physicians in Bayelsa, and since then we've been reporting cases. There are two clades, so it's very important that we understand that there are actually two clades. There are like two types, that have sublineages and lineages and sublineages, and there's the West African, used to be called West African type, which is the clade 2 that we have, and I'm sure we know clade 1B is what's making the round now, because there's a clade 1, which is the Central African type. Yes, and the Central African type would occur around Central African countries, DRC, Congo, Central African Republic, some parts of Cameroon, Burundi, and the likes. Whereas we have the West African type. Luckily, the clade 2, which used to be called the West African type, is milder. Case fatality is pretty low. I'm sure when you heard your narrative, 39 confirmed cases, 0 deaths. I'm sure some people will be shocked. That's not the same picture that you have with DRC. Right. DRC has recorded over 500 cases, 500 deaths already this year. The outbreak has actually been evolving, moving from areas in DRC, of course, with the restiveness and poor healthcare and the likes. What Nigeria has been able to do is to ensure that we enhance surveillance to be able to identify cases as they report. Right. Yes, you talked about countries that have reported around. I've just mentioned Central Africa. So if you look at West Africa, we've had some cases in Sierra Leone, Liberia, Ghana, that have actually reported West African clade. Just recently, Cote d'Ivoire that reported one of the clade 1. So for us in Nigeria, it's important that we know what type we have. And that's why genomic surveillance is also important to be able to pick the cases. I'm sure in the news about an hour ago, Sweden has just recorded the clade 1B. So it means that a case or the disease has actually been identified in Sweden. Right. And of course, with prompt surveillance, with adequate surveillance, you're able to identify cases promptly, and you can actually know what clade that is. Yeah.
But one question that's still, bugging the average Nigerian is why it's taken this long. I mean, the outbreak started in January, and you're only telling us about this outbreak in August. That's about 8 months into the outbreak of the disease in Nigeria. Early warning signals is key, to pushing back or checking the spread. Why has it taken this long, and what exactly is NCDC, putting in place to ensure that things don't get out of hand? Okay.
So after the re-emergence in 2017, where we recorded 88 confirmed cases, we have continued to record confirmed cases. So there is actually, since 2017, there's actually no year that we have not recorded cases. In fact, in 2022, we had our worst outbreak of 762 confirmed cases, Nigeria. And in 2023, we had 98 confirmed cases. By this time last year, April week, as at the end of April week 32, we had 80 confirmed cases. So obviously, it means that NCDC has been doing a lot, with MDAs, the National Primary Healthcare Development Agency, Federal Ministry of Agric, and also very many partners.
May be doing a lot, but if Nigerians are not aware that there's this outbreak, people could just be relaxed and, makes things worse, don't you think?
Yes, and that's why a lot is being done. We've actually beamed our satellites, looking at STIs, because we saw the evolving situation, in Europe and even some cases in Africa where we saw sexual involvement in some of these cases. And we'll be working with, institutions like the with FHI 360, to be able to identify cases amongst, people with advanced HIV disease, And so a lot is being done, even at risk assessment. Yes, it can really never be enough. Absolutely. And it's important that people continue to actually know. In fact, we have done a few studies that have actually shown some low perception in some communities, which we have actually enhanced. I'm sure in 2022, because of the global outbreak, very many persons began to know about monkeypox. You know, it was strange to them, but they began to know, and they can now identify. And one way to prove that there is some form of community engagement in this is to actually look at cases that have been identified. We have actually identified suspected cases of about 780 suspected cases that have all been tested. So we've actually had proper laboratory surveillance to be able to test cases. Part of the gaps that we usually have would be samples being collected from communities, you know, to the state capital. The NCDC has actually put in place a third-party logistics system that is able to move sample, you know, from the state capital to a testing lab.
Let me come in here now. You're talking about the NCDC. I know perhaps now we're talking about the neighboring countries. Let's discuss the kind of collaborative effort the NCDC is having with these neighboring countries, because now Nigeria doesn't seem to or shouldn't work in isolation.
Okay. Obviously, we're not working in isolation. In 2022, with the global outbreak, Nigeria had to be called, you know, to DRC to support surveillance. Myself and a colleague were actually in Kisangani in DRC to support outbreak response in Kisangani, because they actually rely on our expertise, especially with the number of cases that we have, and when you look at the number of deaths that we're having, with that. And this year, we had a disaster threat reduction meeting for Central Africa, but it had to be held in Abuja. You had Burundi, Malawi, Rwanda, DRC, and the Congo, Brazzaville, attend those meetings. So we've actually had massive collaboration. We also have collaboration with Cameroon, to have some form of transboundary surveillance with Cameroon and Benin Republic, because we understand that you can actually have spillage.
Right. So we're talking about Mpox. Help us, for the benefit of our viewers, what do we look out for? What are the early signs that you must look at to say, okay, this is looking like I'm suspecting this might be Mpox, and how quickly should you respond?
So in the
in terms of going to hospital?
Yes, so the early stages of Mpox are usually, you would probably not be able to differentiate between Mpox and other diseases. It might look like a flu-like illness, but eventually, from about 5 to 21 days, you can actually have a characteristic rash. And that's the rash that we get to see, and that would give you an idea of what exactly it is. Unfortunately,
is there anything that identifies this rash? Does it differentiates it from other?
Okay, so you
rashes?
you have very many other pulse illnesses. What you find with this rash, it will begin maybe with a vesicle. A vesicle is clear fluids in a rash, and next thing it becomes a pustule, which is pus in a rash. Other illnesses might present, like that. You might have maybe about a bit of, chicken pox, and other viral exanthem, come up that way. And that's why we encourage that persons who see this rash, especially with previous feeling of fever, headaches, myalgia, pains in the joints, pains in the muscles, are able to also quickly present to the health facility when they notice the rash. Also, we're also looking at, for any community or any household that would have had these features of the disease with a rash, immediately you start feeling unwell, it will be important for you to see, to go to a health facility, because you actually would have to be you'll be a contact, and you have to be monitored over time to see whether the features of the disease.
Testing and diagnosis here now comes into play. How ready, or how what's the capacity of our laboratories here?
At the moment, we have 2 laboratories testing. At the moment, we have the National Reference Lab and the Central Public Health Lab. The National Reference Lab is in Abuja here, and the Central Public Health Lab is in Yaba. And we're able to move samples from the southwest. Mostly will go to Lagos, and the rest of the samples. I just explained about our 3PL, our network of how we move samples. We're able to, but we think that we might need to also, increase labs, especially in all the regions of the country, to be able to promptly identify, promptly test and release results out to health facilities that are managing cases.
Okay, not enough time to talk about vaccines. I hope they're available or they're coming in.
Yeah, they're coming
already.
in. We're expecting 10,000 doses. We've, we've been in the works with National Primary Health Care and NAFDAC. And we already have an operational plan, to be able to get those vaccines in.
Thank you very much, Dr. Odianosen Ehiakhamen. Thank you very much. National Mpox Technical Working Group, NCDC. Just listening to you, you do give us some confidence that everything is under control.
Thanks
no
for
cause for
having
alarm.